Hi, and welcome to Hospice Care of the Low Country, third webinar. We're very excited today on advanced care planning. Today we're doing medical matters. My name's Dr. Debbie Lyons, and I'm going to be your moderator. We're really excited to have you here. Before we get started, I tell you what we're going to do. We're going to ask 3 different poll questions. We're going to really get to know you, our audience, so that the questions in the webinars and the webinars we have are really helpful to people who care. Once again, our first question is going to be right after we introduce our friend. Hi, Janet Porter. How are you? I'm so into medical matters, I almost forgot you today. That's not good.
Hi, Debbie. How are you?
Doing really well. You know, medical matters is something I think many of us want to know about. And we've got 3 poll questions. So let's get started and ask the first poll question of our audience. And that is, have you ever had a conversation with your doctor about what your wishes are at the end of life? I'm going to be curious about how people answer this. Please place your cursor and answer yes or no. And Janet's going to get with us with the poll answers.
Yes, Debbie, just to remind people, all you have to do is move your cursor up to yes or no or don't know, and you'll automatically be recorded. And we usually take a couple, 30 seconds with this to find out. And what we know from research is that a huge percent, like 93% of people, think it's important to talk to their doctor about it, but a very low percentage have actually done it, something like 10 or 12%. So in our audience today, a very small percent, which is typical of the national data, actually have talked to their doctor about their results. It looks like it's about 15%. So this is a good thing for you to think about. Dr. Bob's going to be joining us, who's the medical director of Hospice Care of the Low Country, and he's going to help us understand how to broach that topic with your doctor.
I totally understand what that's like. I think there are many times you go to the doctor with the intent and you run out of time or you get distracted. That makes so much sense. Our second poll question, and once again, we're doing poll questions today as people are joining us, Hospice Care of the Low Country webinar, so that we can really get to know you, the audience. This is a really interesting question, I think, Janet, and one that I'm curious about. Do you have a living will that specifies whether you want to be placed on a ventilator, especially if you are admitted with COVID?
So people can see the poll now. Do you have a living will that states whether you want to be placed on a ventilator as a COVID patient? So this is a tough question, and one that my husband and I thought a lot about when the results came in early on about how few people were able to get off the ventilator when they were sedated and placed in the ICU. And we actually changed our living will to make sure that it was clear that we didn't want to be placed on a ventilator in the event of being a COVID patient. That doesn't mean we don't want it for other things, but in the event of being a COVID patient. And actually none of our audience believes that they've got that covered in their living will at this point. And so people can think about it. We're not trying to influence people one way or another, but this is one thing you want to think about, just like you want to think about whether you want nutrition or whether you want to have a DNR. This is something that you need to think about so that your wishes are honored.
Different world now. I mean, different things. I think it makes nothing better than education. I love it. Our third poll question, once again, at the Hospice Care of the Low Country webinars, we're getting people in, is, and I kind of like this one too. Do you think you're prepared to call 911 for a medical emergency? So again, I'm going to ask it again. Do you think you're prepared if you have to call 911 for a medical emergency? There's a yes and no, and I can already tell you that Janet and I have had a lot of discussions about this.
We have, and I actually recommended to friends of mine that they come on the webinar specifically to hear the tips that Captain Levesque is going to give us. And so the answers are yes, no, or don't know. And what we find for our audience today for our results is that the vast majority say that they don't feel they're prepared, say no. Some say don't know, and about 20% say yes. So this is not something that we think about, but now that we've raised the question, we're going to get you better prepared. So Debbie, I think these have all helped us to get to know our audience better today. And we're looking forward to having lots of conversations, not only today, but we have a webinar in September and a webinar in October that is also going to help with advanced care planning. So, and Jenny Brasington, our executive director, is going to be talking about how you might access all of these videos at any time at your convenience from our website. So good talking to you, Debbie.
Nothing better than on demand. I absolutely love it. And I want to welcome all of you to Hospice Care of the Lowcountry, our third Advanced Care Planning webinar. We are thrilled to have you here today. My name is Dr. Debbie Lines, and I'll be your moderator. Today, we're focusing on medical matters, and we have two terrific guests. I'm really excited. We're going to be joined by Captain Lee Levesque, who is with the Bluffton Township Fire District. He's got some not just good, great tips for us about being prepared in case of an emergency and in case you call 911. Also, our own very Dr. Bob from Hospice Care of the Lowcountry, who is absolutely amazing. He's the medical director, and he's going to be talking about medical matters at the end of life. He's absolutely, I call him very user-friendly. He's great, and he'll answer any questions that you have. Hospice Care of the Lowcountry, I'd love to say, began to offer these free webinars to answer questions many of us have about end of life and medical emergencies. And you know, since COVID-19, I think we're all paying a lot more attention to these conversations. If this is your first Zoom, let me give you a quick update about how it works. You can see and hear me, but we cannot see and hear you. All right. We want to hear from you. So there's a chat button. You can ask questions and we will definitely try to answer those. Just move your cursor and you'll be able to ask the questions. If you click the icon, Darlene Schutz from Hospice Care of the Lowcountry will be there to kind of channel the questions for everyone. So you feel like you are an active participant. We want this to be a really inclusive webinar. Also, if you have any questions, we will try to get to those. I'd like to introduce you now to Jenny Brasington. She is she's been involved for, I think, about 38 years now. Hi, Jenny, in end of life care. She is the executive director of Hospice Care of the Lowcountry and has been for over 10 years. And we are pleased to have you here, Jenny. I'm going to let you take over from this point.
Thank you, Debbie. We at Hospice Care of the Lowcountry are thrilled to be able to offer these webinars. This is our third in a series of 5. Our first one was on the Conversation Project and how to have the conversation. The Conversation Project offers a lot of great resources. You can go to our website and get those resources. They have them for family conversations, the Alzheimer patient, and even how to talk to children. So please go to our website, hospicecarelc.org. And our second webinar was on legal matters. We had Elisa McCrae from Olivetti, McCrae, and Withrow local attorneys here in Bluffton and on Hilton Head, and talked about a lot of the documents that we need at end of life. And today we have Captain Lee and Dr. Bob who are going to give us some great tips. But I want to share with you a little bit of what we do at Hospice Care of the Lowcountry. When we admit a patient, we ask them several questions about their end-of-life documents. Number one, do you have them or do you not have them? And that's living will, healthcare power of attorney, and the DNR. Many of our patients and families have had these discussions at this point of their terminal illness. They've been dealing with this for quite some time, but sometimes people don't have those. So we want to assist them with getting those documents filled out, what their real wishes are, particularly who they want to make those decisions. The DNR, the Do Not Resuscitate document, I would say most of our patients sign that. It is not a requirement for hospice. But some do not sign it. Some just can't sign that document. Often we find that people do not want CPR. They don't want 911 called, but they say they don't want all of this, but they won't sign the document. We did have an instance where a woman just could not bring herself to sign that. She had an episode where she was quite unresponsive. She was breathing erratically. The family panicked. They did not call their hospice nurse. They called 911. Our EMS people, as they do, came very quickly. They did not have that. They did not see that document. So they do what they do. CPR, start IVs, and take to the hospital. She got to the hospital. They did some tests. When our nurse made the call in the morning to schedule her visit, she found out the patient was in the ER. She went to the ER, talked to the family, and they said, we really don't want anything. We want to bring her back home. So the importance of these documents is so everyone knows those wishes and that you have that paperwork signed. And, you know, this was a lot of expense on, you know, calling EMS, a lot of tests that were done that the family really didn't want to have done. So patient came back home. But again, it's so important. And I'm sure Dr. Bob and Captain Lee will talk about some of these situations where if we have that planning, that good planning and that good thought out process, that we can avoid some unnecessary things. So thank you all for listening to us, and hopefully our information will be helpful to all of you. And I am going to turn this back over to Janet.
Thank you, Jenny. That was a great overview of what we provide, and thank you for explaining the importance of having these documents in place. So we've been mentioning that this session today is on medical matters, and I want to reiterate that when you think about advanced care planning and having your wishes honored at end of life, we recognize that it's far more important for you to express your wishes about everything that's important to you at end of life. You know, the key question is, what matters to you? Does it matter that you want to reconcile with your brother? Does it matter that you want to know who's going to tend to your garden or take care of your animals should you pass? What's important to you in terms of who you want to speak to, who you want to make with, you know, a trip you want to go on. So the Conversation Project helps to have that general conversation. We're going to focus today on medical matters because that is a key part of having your wishes honored. But your wishes need to be honored in many, many ways beyond medical matters, and I wanted to recognize that here today. Typically, one of the things that matters is having control over the decision making at end of life, and you can have control by having your wishes expressed in writing and with others, and also by having given over your healthcare power of attorney, which we talked about last month with Alyssa McCrae. And we also know it's important to be prepared for medical emergencies, and most of us never think about this at all. And medical emergencies often involve calling 911, you know, because somebody falls off a ladder, somebody's having trouble breathing. And so what should you do not only to prevent medical emergencies, but to really work effectively with first responders? And we're fortunate today to be joined by Captain Lee Levesque, who is the Community Risk Reduction Officer for the Bluffton Township Fire Department. Hi, Lee. How are you?
Hello, and thank you so very much for letting us play today.
So what we want to do is we want the audience to be able to chat with Captain Levesque. So please chat in. You go to the bottom of put your cursor on the bottom or top of your computer screen, and you'll see something there that says chat. You can click on that, and then you can chat in questions that can be answered by Darlene Schutz, who's monitoring the chat, and I'll be able to see them and ask those questions of Lee Levesque. So Lee, let's start with just getting to know you a little bit, and tell us a little bit about your background in training, because people I don't think necessarily know what training people like you have to be responders.
Absolutely. Well, I've had the pleasure to be a firefighter, medical responder for 31 years, and that has led me through literally thousands of hours of training in those two respective fields, but also towards a bachelor's degree in emergency services. So between the experience and the education, hopefully I can bring something important to bear in this conversation this morning.
Terrific. And you are the captain. So does that mean that all the 911 responders out of Bluffton report to you?
No, we all work together. I happen to work in the fire marshal's division, and in that capacity, I have the pleasure to educate our public and coordinate public relations with our fire district. But I also respond to emergencies along with our traditional, what folks would think of as firefighters and the rest, kind of an added responsibility, if you will.
Great. So with your terrific background, let's start with preventing injuries in the first place so that you don't have to call 911, either medical emergencies or falls, accidents, etc. What are some top tips you would give to prevent having to call 911 before we talk about what to do when you do need to call them?
Absolutely. Perhaps the most important thing to consider is the fact that accidents do and will happen. We all like to think that we're immune to those things, but we've got to take time, at least once a week is our recommendation, to look through our home, look for trip hazards, be it carpets or things left on the floor. Make sure that our smoke alarms work, testing them once a month. Making sure that we have the plans that we will talk in further depth about here in the not too distant future, but also to make sure that we are considering safety in ours and that of those that we love, and even our pets in our own home on a regular basis. That's absolutely paramount.
Yes. And I know one of the things that I've done with my husband is I make him keep his phone in his pants pocket. He's 77 when he's walking around because I travel a lot, I'm gone a lot, and I've worried that he would fall and then not be able to get to the telephone. So he carries his phone with him at all times to be able to call. So let's talk about what tips you might have if you do have to call 911. And I know you're going to talk today about something I don't think the audience is going to know anything about, which is Smart 911. So talk to us about that.
Absolutely. Well, first and foremost, when you call 911, we oftentimes get complaints that they asked us odd questions, but every question is calculated and considered at our end. So please be forthcoming with the answers of those questions, and the quicker and more thoroughly you answer the questions asked by our 911 operators, the quicker and better service that we can provide you. But along those lines comes, as you mentioned, a wonderful program free to everyone in Beaufort County and even Jasper County called Smart 911. It's a program no more difficult than creating yourself an email account. But if you were to go to www.smart911.com, right above me here, it's just a matter of filling things out. It's very secure. You put in information that we should know, you think we should know, be it your medical history, where the keys are, a spare key in case your door is locked and we need to get in, all manner of information. But most importantly, they're going to ask you to put in phone number. At least one. You can put in multiples, but whenever that phone number or one of those phone numbers that you put in your program dials 911, whatever information that you have previously put into this program, smart911.com, will be released to us, the emergency responders, so that we know long before we even get to you that we're coming to a 77-year-old patient with cardiac issues, has fallen before, is on these medications, lives in this type of house, be it an apartment, a standalone, whatever, special directions, color of the house, whatever you think we should know. Now, the key with this program is simply keeping it up to date. We ask that once a month you visit that website and make sure that you change your medications and you change things, little things. Great program, www.smart911.com.
You know, Lee, when we were preparing for this webinar, Captain Lee, and you talked about
Unfortunately, I think she froze. I lost Miss Janet.
if we did a poll on this and asked how many of you heard of this, I think go to our website and watch this webinar, learn about 911 or check it out. So that's terrific. Another thing that we've talked about, Captain Levesque, is kind of having a to-go bag by the door. That you want to talk about that?
Absolutely. Nobody ever wants to think about having to be prepared to go in the event of emergency, but having a small bag that can parlay or work yourself towards hurricane evacuation as well. But something to start with in the capacity of a 911 emergency is having a list of your medications, maybe a change of clothes. God forbid, Mama always said, don't leave home without clean underwear, for Pete's sake. Make sure that's all in a small bag in a common place where you and your loved ones know that it is. In the event of 911, you can grab it or direct us to grab it for you. We are, in fact, service providers. We're happy to help in that capacity. But a small go bag with things that you might need, and of course, they're unique to you. Not everybody will have the same thing in a bag. Not everybody needs the same thing in the event of a 911 call. And the only way to determine what you need is for you to consider it ahead of time. Unfortunately, we don't have the luxury of rational thought in the event of emergency, but we do today. Take the time today to put that bag together, to fill out in Smart 911, to make a plan and even a backup plan in the event of an emergency. Know what you're going to have to do when you dial 911. Now, think about it rationally. So when it's an irrational time, it's just a matter of referencing what you already know.
Yeah, since I've talked to you about this, my husband and I just took a plastic Ziploc bag and put all of the names of medications, the names of all of my medications, all our insurance information, Xerox copies of our insurance cards, and then our living wills. We put all of that just in a Ziploc bag, and it's in the chest that's right by our front door. And Jim and I both know to grab that going out the door. If we had never thought about that, and everyone I've talked to in preparing for this webinar has said that is such a good tip, that they had never thought of that either. And, you know, so that's one of the mistakes I know people make when they call 911 is they're not prepared. They don't have that readiness. So these are good tips, Smart 911 and having a to-go bag. But what are the other mistakes people make that you want to help people to understand relative to calling and interfacing with 911? What are some other mistakes?
Perhaps the biggest mistake is not calling. Embarrassment kills more people in America than any disease that we can consider. I can't tell you the countless times in my many years in this emergency service that a spouse has said, well, he or she said don't call 20 minutes ago, but now they're unconscious, or now they're this, or now they're that. And unfortunately, our hands at that point are long tied. The point is, folks, there's no penalty for calling us out and it not being as bad as you think it is. Being embarrassed that your neighbors are going to hear our lights and sirens, tough stuff. It's your health and your life. Call us. Don't ever be afraid. That's what we're here for. We do it. Fire department does not provide bills. We're happy to come out to you and serve you. It's what we're here for. However, on the planning side, if you have questions, again, don't be embarrassed to reach out to us ahead of time. Call or email. You can always reach us here in Bluffton at info@blufftonfd.com. Pick up your phone, do a Google search, call folks at hospice, nurses, doctors. Be honest with yourself and those around you, and leave embarrassment alone. Do what's right for you. That's the most important thing.
That's a great quote. Embarrassment kills more people than anything else. I know, it's like, I don't like the way my hair looks. Don't call 911.
There it is.
You know, I mean, really. Yeah, and you guys see that every day. Anything else besides, if in the event you think you need to call 911, anything else that you can think of that you want to give tips to people on today?
Well, I'll tell you, there are so many things that can be done, be it family members learning CPR, yourself learning CPR. Those programs are out there in many fashions. Learn CPR, cardiac. I joke about the embarrassment. Cardiac related issues are the #1 cause of death in America today. And to that capacity, the best thing you can do for cardiac patient is provide early onset CPR. Automated external defibrillators all over our community. We, in fact, are putting them out there in common places. Become familiar with where they are and how to use those things. Again, it's all in preparation, and everything we've discussed thus far is preparation, be it individual or community preparation. Just take the time. If nothing else, folks don't remember anything you and I have talked about today or that I've presented, is be prepared. And the best way to do that is to prepare now for what is inevitable to come later.
And Lee, let's make it really easy for people to do that. So where would you go if you wanted CPR classes?
I will tell you, we have many websites that get us there. In that particular case, it's BTFD, Bluffton Township Fire District, BTFDCPR.com. All of our classes that we provide in-house, and we can come to you as well to teach them. Post-COVID, but just all the classes are listed there. Ways to reach us for those particular educational endeavors are listed right there. You can always email us again at info@blufftonfd.com, and we'll facilitate you there, or simply call us 843-757-2800.
Wow, what good advice. We are so grateful to you for joining us today, Captain Levesque, and thank you for everything you do. You know, I think the COVID and of course, 911 did, but COVID really has also shone a light on what heroes first responders are and what a difference they make in communities. And so we appreciate that you're one of those people who is, at the ready every day, helping people who are at risk. And thank you so much for joining us today.
Well, thank you for such a wonderful sentiment, and anything we can do, please don't ever hesitate to reach out to us.
Thank you. You've been a good friend of hospice. We appreciate it.
My pleasure. My pleasure. Take care.
So to continue our about medical matters, we're going to have Dr. Bob Briard join us. And Dr. Bob has served as medical director for hospice care of the Low Country for 3 years, but he has a rich background in end-of-life care. He's an oncologist by background. And I'm going to ask Dr. Bob. Hi, Dr. Bob. How are you?
Good morning. I'm good. Thank you.
I'm going to ask you to tell people a little bit about your background too, because you have a rich background and came with so much experience to hospice care of the Low Country. So would you talk a little bit about that before we get started?
Well, sure. I practiced oncology in San Diego for about 35 years before retiring. And during that time of my practice, I did become involved with a couple of hospices locally in San Diego. And the reason is that so many of my patients, unfortunately, didn't survive their illnesses. And I felt that I needed to be more involved with that very important segment of their life, and that is the last weeks or months. And I came to understand how much that can be done for these people. I think that there are two really signal events in your life. One is being born, and the other is dying. And both of those events deserve a lot of attention and care, and hospice is able to provide that. And I think that's what I was made to do, and I love it.
Dr. Bob, I think you've expressed the sentiment of a lot of us, staff, social workers, nurses, our clinical nursing assistants, our chaplain, so many, our staff that runs our bereavement programs, the board, is that all of us feel like this is really a calling to support people and so that they can die with dignity. And also to support the families. Of course, so much what we do is to support the families. So, and I find that most of the doctors that I've worked with around the country, feel the same way, that it was something they were drawn to. So let's talk about one of the major things that you talk about medically to help people get ready and prepare for end of life. So what would be your top recommendations so that their medical wishes really all are honored?
Well, I think there has to be a bit of a background before you get to that particular subject, and that is a face-to-face meeting with the patient where you discuss and acknowledge some of the issues that they're going through. And you mentioned one a little bit earlier, and that is loss of control. Many of us sort of have the foundation of our life centered around being in control of what happens to us and what we do. So that's an important thing. Another thing is dignity. People want to be treated with dignity, and that dovetails into the whole question of CPR, which is at best an undignified procedure, which we'll talk about in a minute. The other thing that people have is fear of pain and suffering, and the reassurance that we can help them with that is very helpful, and also helps them make decisions. They don't have to suffer loss, abandonment. Usually, or many times, the physician who's been taking care of the patient for years turns them over to hospice, and that physician isn't able to perform the hospice goals, to carry out the hospice goals, because they're in an office seeing patients all day. So it's important that we reassure the patient that they're with them through thick or thin until the very end. And then people say, well, how much time do I have? And almost a universal question. Of course, none of us know. That's not our domain. I mean, we have a feeling about it. We can give them a range, but nobody can say exactly how long they have. And that kind of dovetails into the CPR discussion. And I think one of the most important things that's already been referenced is what exactly is CPR and what are the outcomes likely to be? And we know from science that performing cardiopulmonary resuscitation, compressing the chest to maintain heart rhythm until it returns on its own, does not extend the life of anybody with a terminal disease. It does not improve their quality of life of people with a terminal disease. In fact, CPR is something that can cause significant injuries and decrease the quality of life at the end. The other thing is, what is the survival rate of CPR? If you look at all comers, it's less than 10% of patients who have had CPR either in the field or in the hospital will end up leaving the hospital. And most of those will not have the same quality of life they had before they had the episode. So the real benefit of CPR, which is undeniable, is in people who, for example, have been electrocuted or drowned, or a young adult who has an unexpected cardiac rhythm problem. In other words, people who have an expectation to live the life they lived before they had the episode. And those of us who have chronic illnesses, particularly if we're in hospice, need to think about how we want to spend our last days. Most of the time, dying is a very peaceful process. As I like to say to my patients, well, what's going to happen is you're going to fall asleep and wake up in heaven. And that's our goal for our patients, to make their life as good as it can be. And almost universally in our setting, CPR is not part of that.
So Dr. Bob, what else about, what other decisions too about living well is related to nutrition and ventilator support? Would you talk about those?
Yes, I think that when you're dealing with your living will, you need to put in the front of your mind, what are my expectations when I get into a situation where my life is threatened? Do I want to spend the rest of my days unable to communicate because I have a tube down my trachea and I'm on a ventilator? Do I want to prolong the suffering that I'm enduring, knowing that the end is inevitable anyway? And having thought about those things, it's pretty easy to say, gee, I don't want a ventilator. The harder one comes with nutrition, providing nutrition in people who aren't able to sustain themselves independently. From an ethical point of view, a moral ethical point of view, it's universally agreed that artificial feeding is an extraordinary measure, just like CPR is an extraordinary measure. And you're not ethically bound to provide that to a patient, particularly if they don't want it. The other thing is, it's okay not to have tube feedings or IVs, because most patients who are near the end don't experience hunger. They don't experience thirst. Their mouths may be uncomfortable, and we can certainly help with that, but they're not suffering from malnutrition. It's not causing symptoms. But it's certainly an emotional thing for the loved ones. You can't let grandpa starve to death. Well, he's not starving to death. It's part of the natural dying process to stop eating. So you can outline that and make sure that nobody puts a device in you to feed you. And,
and when we talk about nutrition, we're talking about what the common populace would think of a feeding tube. And we know we have these stories of people in persistent vegetative states where they put feeding tubes in, and they prolong the life of the person, but the person never wakes up.
Correct.
And so, what we focus on at Hospice Care of the Low Country is quality of life and honoring people's wishes. And we can do that, and the family can do that if people are clear about that. So we talked earlier, Dr. Bob, today about having a living will and talking about your wishes with your physician at end of life. And so what do you recommend to the audience to broach that subject and make it clear to your physicians, not just when you're at end of life, but you're riding a motorcycle without a helmet a lot. You should have that conversation if you're 19 years old, right? Let's talk to us about how you think physicians want to be approached by their patients to have that discussion.
This is one of the hardest things I think a physician has to do, and it certainly was for me when I was in practice, and that is to be honest about the situation, but provide hope at the same time. Yes, Mrs. McGillicuddy, unfortunately, we can't cure your disease. In fact, we don't cure anybody in the end. So acknowledging that in a gentle way without abandoning the patient is very important, I think, and will allow them to make decisions better. The other thing that's equally important is communication with the family and loved ones about what your desires are. It may be written down on paper, but unless you have a discussion, and we've talked about this before, having the discussion to your children, to the son who's in California and you're in Hilton Head and you haven't talked to each other for 2 or 3 years. You don't want that son appearing on the scene demanding why his father is not on a ventilator. So settle these things ahead of time. It's a little uncomfortable at the beginning, but it's part of life. And you've got to deal with that. So those are the two things I would.
Dr. Bob, I'm a hospital administrator, and anybody who works in healthcare, nurses, doctors, hospital administrators, has witnessed real fractures in families with patients where the family members, 3 out of the 4 children agree, but the one does not, about what to do or how much, and they really don't know what mother's wishes are or father's wishes are. And not only does that make it very challenging for us to honor the person's wishes and provide quality of life for them, but it oftentimes provides lifelong family fractures over what was done at end of life. People are mad, years later. And so I think all of us want our children, our loved ones, our brothers and sisters to, in addition to grieving your loss, not have to have conflict in the family, lasting conflict over what was done for you. So this is a gift, we give those we love who care about us. It's a gift for them to know what your wishes are and everybody to have the same story. And we work so hard on that at Hospice Care of the Low Country to honor people's wishes. So any other advice you want to give people, Dr. Bob, today?
Well, something just occurred to me that as you were talking, Janet, and that is that we have maybe 30 or 40% of our patients aren't able to make their own decisions because of neurodegenerative disease. And even if they have a living will, an advance directive, sometimes there are issues and conflicts. And I think it's important to remember that even if somebody is unable to express his wishes at the moment, his previously or her previously stated wishes hold force. And to make that work even better, if the caregiver knows that patient well enough to confirm that this person never wants to be on a ventilator or a feeding tube, that often will help with the family issues.
Yes. And I think personal stories make such a difference. When my mother had her severe stroke and was in the hospital, they were doing so much because she'd had this severe stroke. And I flew to Akron and then flew back to Boston. And finally I got my sisters and I have 2 sisters, and we got on the phone with a palliative care doctor who said, was your mom clear about her wishes? And we said, absolutely. And she said, okay, what did your mother want? And we said, our mother didn't want this. She didn't want feeding tubes and ventilators. And she said, then you're honoring her wishes. You're giving her love back to her. So I flew back to Akron. We pulled everything. She went into hospice care. She lived a year in hospice care and had a good quality of life and good support through hospice care. And she was very, she was very conscious and very appreciative that we were honoring her wishes. So, what we are passionate about is having everyone have that kind of knowledge and support so that we can do the right thing for those we love. So Dr. Bob, thank you so much for joining us today. We really appreciate it. And we are so grateful to have your leadership at Hospice Care of the Lowcountry.
Thank you. It's a great, great team.
And now I want to turn this back over to Debbie. Hi, Debbie. How are you?
I'm wonderful, and I've been dying to pop in throughout the entire exchange. I've learned so much. Dr. Bob is really compassionate, and it's so interesting. And Lee, I once again took notes, and yes, just so everyone knows, we all have Smart Call now on our phone, correct?
Yes, yes.
Absolutely love it. If any of us, and I feel like I'm a layperson here, okay? So I feel so honored to be able to be the moderator. And I've learned so much about advanced care planning, and I feel like I'm fairly educated. So I think many of us are feeling the same thing. Again, Lee, Dr. Bob, Janet, Jenny, all the things you talked about today, especially profound, especially in this crazy time of COVID. I think we all learned so much. This is our third webinar, and there are going to be a couple more. Let me tell you what they are. The fourth webinar is September 11th, and this is going to be on grieving and bereavement. I'm really looking forward to this one also. Barbara Scobie, the Hospice Care of the Lowcountry Bereavement Director, and Charlie Tyler, the Hospice Care of the Lowcountry Chaplain, will be joining us. And I think we're going to learn a lot about the support that hospice gives and has available, which I know from experience was really helpful when I lost my mom. Next, on October the 9th, that is going to be the fifth of the Advanced Care Directive webinars through Hospice Care of the Lowcountry. And this is going to be another one. I think we don't know what we don't know. And it's going to be wonderful to be educated about planning a funeral. Sherry Stahl, Simplicity Burial Service, known her for a long time, and Valerie Mayer of Island Funeral Home will be joining us. And let's just say these webinars are amazing. I think not only are they live, but they're going to be on demand, which means you can watch them at any point in time. I know sometimes I get caught up in listening to what people say. It'll be nice to be able to review again. So I think that is wonderful. Please know that you'll get a survey following the webinar. We really appreciate your comments and your feedback, because we want the webinars to be meeting your needs. It's really important. Anyone can join these webinars. Please share that they are available. Let your friends know. And that Hospice Care of the Lowcountry is always here for you. And if there's ever been any question of that, I think today, talking to Dr. Bob, Janet, and Jenny, you'll know that they are here for you. We want to thank you all for joining us here today. Enjoy. Thanks again. Bye-bye.